Before we get into today's episode, I need to say this clearly. Healthcare should not be a political battlefield. It is a shared human need. And if we are truly a first world nation, then access to care shouldn't depend on your politics. It should depend on your humanity. This episode isn't left, it isn't right. It's about the real history behind the ACA and how the system actually works and why access to care matters for every single one of us. Roll the intro. Welcome to Insurance Unwrapped, where we strip away the jargon, unwrap the truth, and talk about what insurance really means in everyday life. Whether you work with Core Insurance Services or another agency, we always recommend you connect with a licensed agent or broker, someone who can help you make informed choices and protect what matters most. Because insurance isn't fear, it's freedom. All right, let's unwrap this. Before we begin, a quick reminder. I don't care what political stance you have. I don't care who you vote for. My job is to advocate for all of my clients. Healthcare affects everyone, period. And today's episode is about clarity, not politics. The political climate right now is hot. People are emotional, overwhelmed, and hearing a lot of noise. But if we strip away all that noise, we're left with one truth. Every human being needs access to care, and the ACA was built around that reality. One thing most people don't know, the Affordable Care Act wasn't created in 2009. It wasn't born during a single presidency. It was a bipartisan framework that took over 2 decades to shape. Whoever sat in the Oval Office at the time of its passage was going to get the name credit. That's it. If McCain had won, we'd be calling it McCain Care right now, but the foundation would have been the same. Somewhere along the way, we forgot the U.S. was built on a mixture of political, economic, and social constructs. We benefit from capitalism, we benefit from socialism, we benefit from shared public resources, we benefit from free market competition. Our system has always been a blend by design, so we could get the best of all worlds. If you don't believe in socialism, don't drive on the freeway. If there's a pothole, your first thought is, why don't they fix this? If someone breaks into your home, you dial 911. If you don't like shared systems, don't call the police. Also, for capitalism, people don't always realize that they want capitalism when they're shopping for health plans. You want choices of carriers, you want your preferred doctor, you want options for lowered premiums, richer benefits, or bigger networks. That freedom, that ability to choose is capitalism working for you. And competition drives innovation. New treatments, new tech, better services, that's one upside of having private companies in the game. I say it all the time, healthcare should never have become a political football, but here we are. What I want people to remember is this: healthcare is a shared value, not a partisan argument. The Affordable Care Act expanded access by introducing the Advanced Premium Tax Credit, the APTC, which lowers monthly costs for working families. People who never could have afforded insurance before could finally get access. It changed what minimum essential coverage meant. Mental health became real health, maternity became guaranteed, prescriptions became guaranteed, preventative care became guaranteed. The ACA legitimized mental health as healthcare, not supplemental, not optional. That was a historic correction. Before the ACA, carriers could deny you for being sick, they could drop you, they could refuse to cover meds, they could cap how much they would pay for your care in a lifetime. Families were losing their entire retirement funds, their homes, their savings, not because they were irresponsible, but because they got sick. Even with the high cost of insurance today, the fact that we have a federal cap, a maximum out-of-pocket or MOOP, means your medical bills have a stop button. Before the ACA, there was no stop button. Is it perfect? No. Should it be better? Absolutely. But we cannot forget what the system was before the ACA, and nobody wants to go back to that. So today's message is simple. The ACA wasn't a political gift, it was a national need. The US was built on blended systems for a reason, and healthcare is something every single person deserves to access, not because of politics, but because of humanity. This has been Insurance Unwrapped, where we demystify coverage and bring clarity to a system that affects all of us. Your care matters, your protection matters, and having the information you need to make the best decision for yourself isn't optional, it's essential. You are not alone in this journey, and when you understand your coverage options, you gain the freedom to choose what truly supports your life. If this episode helped you, share it. Subscribe for more, and if there's a topic you want me to unwrap next, let me know in the comments.